Hello, everyone. This is Ana Maria Tirano, Vice President of Marketing at Cincy. Welcome to today's webinar, Accelerating Care Through Technology, the Role of a Virtual Care Communication Platform at ProHealth Homecare. Please note that attendees are muted during today's presentation. If you have questions at any point, please type your question into the chat window on your control panel. At the conclusion of the webinar, we will review the questions and answer them accordingly or follow up with you individually. Today's presentation is being recorded, and a link to the recorded webinar will be sent to all attendees in the coming days. Today, I'm honored to be joined by Laura King-Babcock, lead nurse of ProHealth Homecare. Laura is an RN and has been overseeing the home-based palliative care program at ProHealth. She delivers palliative care and hospice care in the greater Sacramento area. Laura has hands-on experience with using Cincy's virtual care platform with palliative care patients, and she will highlight a few use cases and share her insights on this topic for all of us to learn from today. Let's start with a quick review of key figures related to the chronic care patient population. According to the U.S. National Center for Health Statistics, 133 million, that's 40% of the U.S. population, suffer from chronic conditions, and almost a third of them have multiple chronic conditions. This population accounts for 3/4 of the $2.2 trillion in healthcare spending, according to the CDC. That means roughly 96 cents per dollar in Medicare and 83 cents per dollar in Medicaid is spent towards this population. But where do these patients want to receive care? They want to be home. AARP says that 87% of consumers 65 plus want to age at home. However, it's challenging for home health agencies to manage and engage these patients and keep the sickest of the sick at home, receiving care versus returning to the hospital or another facility. Unfortunately, these patients typically need more care and attention after being discharged and often rely on EMS and or the ER to answer questions and provide care in non-emergency situations. The budget and resourcing implications are significant when most of your staff is spending their time behind the wheel versus in front of a patient. Changes under PDGM may also impact an agency's productivity and profitability going forward. Significant opportunities exist for virtual care solutions to bring critical yet compassionate care closer to the patient in a more convenient and cost-contained manner for all involved. Home health agencies are recognizing the value of implementing a virtual care communication platform. Using this platform, home health clinicians are able to quickly connect, communicate, and collaborate with each other to ensure patients are actively monitored and motivated in their care virtually. Patients are also empowered to actively participate in their care by having the ability to simply connect at any time with a member of their care team. The video-based virtual visit can also include a specialist, a pharmacist, and even an interpreter, depending on the patient's needs. In today's session, Laura of ProHealth Homecare will show how her agency is using virtual care to support their palliative care patients. She will share her hands-on experiences in using the platform and lessons learned so that others can evolve their continuum of care models. To deepen patient engagement, healthcare organizations are turning to virtual care to educate and enlighten patients. Patient portals, remember them? They're not necessarily preferred by patients. A software advice poll indicated that patients are typically frustrated with the design and the user experience of the portal tools, and that 41% actually give up on using portals after being overwhelmed with an inability to navigate options. Instead of relying on a static portal, organizations are now embracing the dynamic nature of video, email, text, and SMS to reach patients via their devices. As a result, Patients are receiving timely and thoughtful appointment reminders, medication updates, and healthcare messaging in a manner that reflects how and when they use technology on a daily basis. Patients appreciate this access to care from the comfort and convenience of their home, on the device of their choosing, and in the modality of their preference, along with their primary or preferred language. Patient engagement apps can help patients better understand their healthcare situation, be better prepared for their role in self-care. The timing of the delivery of the information can be as important as the message itself. As Stanford Medicine patient advocate Hugo Campos stated, no patient wants to engage with healthcare. They want to engage with life. Virtual care is one of the latest technology advancements in healthcare, reshaping how real care is delivered. The Alliance for Home Health Quality and Innovation contends that patients who are receiving care in their preferred location, which is their home, are more likely to adhere to care management plans, improving their overall health while preventing avoidable readmissions and costs. Patient expectations in requesting and receiving home health care is evolving. Home care is actually the most unique practice setting because the nurse or other team member must fit into and function effectively in the patient's space and their most beloved space, their home, rather than the patient fitting into the hospital or another clinical setting. The visiting clinician must adapt, be flexible, and it changes the dynamic associated with more traditional healthcare settings. Home health team members are essentially guests in patients' and family lives and in their homes too. To best serve and support patients, home health clinicians are advised to see patients as partners in care with great influence on how and when the care is delivered. Home health care must be patient-centric by nature and reflect and respect the patient's lifestyle, values and belief system, home environment, and relationships with families and friends. Laura of ProHealth Homecare is now joining us to provide an overview of her agency's services and use of virtual care. Laura, would you like to present an overview of ProHealth?
Yeah, so ProHealth is one of the fastest growing home health and hospice agencies in Northern California. And we've actually, for the third time, been listed as a Homecare Elite winner. And that's one of only 8 area agencies to win that award, so that's pretty exciting. JCO accredited and certified for home health and hospice services. And we do focus on providing clinical excellence and compassion, one patient at a time. And that's been happening for over the past decade. We've brought quality healthcare home for thousands of patients in our communities with a keen focus on personalized care. We do offer a full spectrum of home health and hospice services, which range from nursing care, physical therapy, occupational therapy, speech therapy, and even sending out registered dietitians when it's indicated the patient could benefit from those services. We are local, a socially responsible Bay Area agency. We are committed to providing the best possible care to local residents through a focus on quality care and by catering to the various preferences, ethnicities, and languages that makes the Bay.
I'll quickly provide context for the virtual care opportunity at ProHealth. In terms of background for the use cases which Laura is about to share, ProHealth has been partnering with HealthNet Centene to support members who require palliative care services. There are approximately 300,000 members, 180,000 after hospice, that are stratified by high, moderate, and low intensities. ProHealth sought to provide quality care more efficiently by supplementing in-person visits with virtual visits. And clinicians who will occasionally participate in virtual visits are HealthNet's medical directors and community PCPs. At the start of the implementation, ProHealth and Cindy facilitated an on-site deployment meeting and discussed several key questions with the agency's executives and staff. Questions such as, identifying which ProHealth team members are interested in using virtual care, which patient populations does the team care for, how will these patient populations benefit from virtual care, how will each team member benefit from using virtual care, and how can virtual care supplement a team member's regular cadence of in-person visits. Cindy then configured the platform, reviewed the setup with ProHealth executives, and initiated the staff rollout. Clinical staff member training sessions were conducted, and Cindy also participated in ProHealth's Corporate Nursing Skills Workshop. During the implementation, ProHealth's clinicians were excited to learn that the platform is very intuitive and easy to use, and the system offers a great user experience for clinicians, patients, and caregivers. Rolling out the virtual care platform is not invasive nor burdensome. Jasmine Valdez unfortunately wasn't able to participate in today's webinar due to another conflict with her schedule, but she actually has a wonderful quote where she says, "Take everything you remember about your last EHR implementation and throw it out the window. Cindy's in town, much easier all around." With this context in mind, please listen as Laura shares a few use cases at ProHealth.
So the first case I would like to share about was actually one of the first times I was able to use the Cindy platform. And I had a female patient that I see long-term in the community, and she's got a tracheotomy due to vocal cord paralysis. So she's bedbound and stuck on machines. She can't get around very well. And her daughter's her main caregiver. So usually I would drive an hour to go and see the patient, and that's only one way. So it's an hour back as well. And her daughter was concerned about the color of secretions, like oral secretions that she was suctioning from her trach. She was worried that she was getting a respiratory infection. So she was able to initiate a video chat with me using the app, and I was able to visually assess the secretions that were in the suction container and determine that they did look problematic. So I could then call the primary care doctor and let him know I saw the secretions, and based on the way the patient appeared, her daughter's assessment, knowing the patient wasn't herself, she actually did have a fever. Her daughter was able to check her temperature during the video chat. The doctor was able to get her scheduled in, and he did a phone call appointment with the patient because she's hard to transport to the ER and to the doctor's office, and he actually was able to prescribe some antibiotics, which the daughter was able to go and pick up within 4 hours, and the patient was treated for pneumonia or bronchitis, and she got better. So there was no emergency room used. It saved me time, 2 hours of time, and that doesn't include the assessment I would have spent at the home. So it was really helpful, and the patient's daughter was really grateful that it got her such quick access to her nurse, and the assessment was done, and then the antibiotics were there. All in a matter of probably about 6 hours from the time she initiated the video visit with me to the time she gave her mother the first dose of antibiotics. Our next case, as an example, is another female patient. She has multiple conditions. She's bound to a wheelchair. She can't ambulate very well, and she does have a long-term Foley catheter. So those are problematic for recurring UTIs. They carry a high risk of causing urinary tract infections. And so the patient's daughter was checking her catheter and draining the urine bag and noticed it had a foul odor and was what we call cloudy. So we did a video chat, and I was able to look at the pee and realize that most definitely the patient had all of the classic symptoms of a urinary tract infection, which can be very dangerous if not treated, quickly. So same thing, I was able to call the doctor, and the doctor prescribed a prescription for medication. We were able to set up a follow-up appointment for the patient with the primary care doctor, but she was started on antibiotics the very next morning because this call came through about 7 or 8 o'clock at night, So it really saved me a lot of time, and I didn't have to get up and leave my home to go and see this patient. So very helpful. Our next patient is a male patient. He actually has a primary diagnosis of brain cancer, but he's in remission. So we see him palliatively just to monitor how he's doing and if he continues to recover and stay in remission, versus if he has a relapse, we can get care in really quickly. He's actually pretty far away. It says an hour, it's actually more like an hour and a half with traffic. And he had developed some type of rash. His daughter had called me, and it was a rash that was very painful. So I was able to actually initiate a virtual visit. And then the cool part about this example is we were able to bring in our nurse practitioner on the call, because you can add up to 6 people in a call. So if the doctor participates in the Cindy app, we can actually bring the doctor into the virtual visit. So this nurse practitioner I was able to bring into the call, and we collaborated and determined the patient had shingles. It's very painful. So we were able to get him into be seen, and they got him started on some medications to reduce the symptoms and keep him comfortable while he let the shingles run its course, because you can't really do a whole lot to make it go away. But we were able to get him comfortable and diagnosed, which brought down the anxiety level of his family, knowing what he had and that he was going to be okay. Our final case is a pretty neat situation. So I have a patient in Sacramento. He has no living children. He's 89 years old. He has no other family in California. His medical and durable power of attorneys both live in Wisconsin, and it's his niece and nephew. So his niece actually is very involved in his care. She's a wonderful family member to have. And she flies out to California when he has doctor's appointments and specialist appointments, or if anything happens with him and he's admitted to the emergency room for more than a couple of days, she flies out to be with him, to advocate for him, to make sure his needs are being met properly. So what we're able to do with her is every time I go and physically see the patient, she will call in and join the visit virtually through the app. And that gives her the ability to feel connected and, be a part of the care he's being provided through our palliative care program. And I mean, she's just so happy that we use this app, and it gives her access to him without her having to fly out and witness all the services we're providing. So there's some lessons that have been learned since we started using the Cindy app. The first thing says, be patient. It takes time to adopt something new. And to elaborate on that, initially, patients are a little hesitant to use virtual visits because they don't want to lose that hands-on personal care. So what we've been able to do is, like they said earlier, we divide our patients in the palliative care program into high, moderate, and low intensity, and that dictates how many visits they get a month. So if a patient's high intensity, it means they take a lot more care. They're in more critical state. Usually they have many comorbidities, which basically is other diagnoses. And so we are able to use the virtual visit for what we call PRN. So if a situation comes up and they need to see a nurse right away, but nobody can get to them fast enough, we'll do a virtual visit. But also, we always schedule an in-person visit, and we do a virtual visit for that second visit that month or that third visit. And so it provides them with still having a nurse come out and see them. They still get that personal care that they want. And then what we've noticed over time is that the patients get really comfortable once they use the virtual for a couple of appointments. They start to realize how amazing it is and how easy it is to use and navigate through, and that they're more open to using virtual visits more than in person. So it does take time for them to get used to something and it's new. Also, we have a lot of elderly patients, and sometimes technology can overwhelm them. So I will usually be at their house, and we will do what we call a practice run on the application. And that way if they have any questions or they get stuck anywhere, I'm right there to walk them through it so it decreases their anxiety and hesitancy to use the app. The third is usually our biggest barrier, which is not all of our patients have the devices or the technology needed to run the app. So our palliative care program, our demographic for our patients is low income. So a lot of them have, free cell phones without a data plan, or they don't have internet because they can't afford it. They don't have computers or laptops. I have a couple patients actually still have flip phones. But what we've done is we've focused on their caregivers. So usually their caregivers do have a device. So we'll schedule our appointments when we know the caregiver is there, and the patient can use their phone or their tablet to facilitate the video visit. So it works out. If we troubleshoot, we find ways around the barriers, and it works really well.
Thank you, Laura, for sharing your experiences, especially your hands-on use of the virtual care communication platform to really alleviate the stress involved in caregiving on behalf of the family members as well as the patients themselves, really 24/7. ProHealth going forward is expanding their use of virtual care. So the plans are to roll it out to hospice and home health patients in addition to the palliative care arrangement that they have with HealthNet Centene. They will also be supplementing in-person patient therapy, physical therapy visits with the use of a virtual care platform, as the video-based platform is very robust and allows for clear, crystal picture quality for everyone to see exactly what is going on. Using this platform is allowing ProHealth to secure more referrals, and this allows them to take on an increased patient workload, improving both their productivity as well as their profitability, with the end goal, of course, to prevent readmissions and minimize unnecessary and costly ER visits. Future expansion includes the implementation of more patient program-focused engagement and communication paths. They do, of course, rely on the use of devices such as smartphones, tablets, and video-enabled PCs. And as Laura pointed out, if the patient doesn't have it, typically their close family member does. What we need to keep in mind is also recent Pew Research Center data of U.S. adults. Share of Americans that own smartphones is actually now 77% in 2018 versus 35% in 2011. And thinking about especially patients who are more likely to have chronic care conditions, 67% of baby boomers and 30% of the silent generation own smartphones. More than half of boomers own a tablet computer, and many, 55%, currently use social media. The silent generation, those which are aged 73 to 90, may lag behind other age groups in device ownership, but a quarter of this segment actually has a tablet computer, and almost a quarter use social media. So it's critical to leverage any type of application to increase patient engagement. If we turn to the examples in front of you, here's illustrative examples of how a patient engagement program can be designed. Depending on the condition, patients can be put into a specific communication program with various types of touch points, all scheduled to ensure that patients are actively managed, monitored, and motivated in their care. In a situation with ProHealth, their administrators use the Cincy platform to then engage these patients to take the appropriate action. Could be taking medication, could be participating in a virtual visit, or refilling a prescription, all according to protocols set up for the specific condition or conditions that the patient might have. And patient preference on communication modality is factored into the touch points. ProHealth uses multiple channels, email, SMS, text, virtual visits to engage the patient and his or her family caregiver, as Laura had pointed out. Depending on the patient's perceived risk of readmission, the agency administrators at ProHealth are also going to designate specific programs that's either condensed or spread out over weeks and months to make sure patients are receiving attention and compassion. When appropriate, even a message such as a flu reminder can be pushed out to remind patients of proactive lifestyle recommendations. Thinking about scheduling the cadence of communications, you can especially think about when a patient is first discharged from a hospital or other care facility and what needs to happen really within the 24 hours to welcome them to this type of virtual care communication program in addition to any in-person visits that they might have. You can just see within the first 30 days what an example of cadence of messages could be, as well as the type of consults and visits which may occur. Messaging can be pushed into the patient's preferred or primary language. This really ensures that there is deep understanding and engagement of patients of all cultures and backgrounds, regardless of their ability to speak or communicate in English. So this is an example of what can be done with the platform, and has needed, an interpreter can also be brought into the conversation, a medically certified interpreter to ensure that the patient, remote family members, medical professionals, whether they're clinicians and or specialists and or pharmacists, all clearly understand and communicate with each other. Virtual care can help patients be more mindful and motivated in their ability to better care for themselves at home. They help the patient better understand his or her condition, treatment plan, and role in managing one's health going forward. Because the patient can access care from his or her home, and at a time when one might be more responsive to a provider's message, virtual care supports patient education efforts. Providers can also use the video-based virtual visits to bring to life discharge protocols, medication guides, and the overall treatment plan while discussing it within the context of the patient's actual routine at home. Healthcare organizations are recognizing the benefits of using different communication modalities to communicate appointment updates, dosage and refill reminders, and diet lifestyle recommendations to their patients. This engages patients in a more efficient manner than the typical phone calls and voicemails, which typically result in a considerable back and forth between patients and providers. Technology is also helping to engage patients more effectively as they appreciate being kept in the know about how they can take care of their health on a daily basis. Virtual care also helps the healthcare organizations better monitor and manage their patient population. During a virtual visit, providers can quickly identify and immediately act upon a patient's emerging issue, and whether that means including a pharmacist in a call to review the medication or incorporating a clinician to address the patient's changing condition. One can also reach out to EMS for urgent intervention. And then the data is everything. Looking at when, how, and how often a patient is engaged virtually with an agency helps administrators optimize their staff scheduling around patient preferences. Patient-driven staffing helps ensure that the most appropriate information care is communicated to a patient at the most appropriate time for the patient, and that also any emerging issues, meaning that a patient hasn't been responding to any requests for upcoming appointments or even attending and participating in the virtual visits, will alert the home health agency to take more proactive measures to make sure that the patient is properly cared for in a very timely manner. What does this mean for home health, for palliative care, for hospice care, and broader post-acute care organizations? Means that the focus on improving outcomes and minimizing readmissions is more important than ever to help your patients and also protect your referral streams from hospitals and health plans. Virtual care can help home health clinicians deliver the important care where they are needed most and help remove barriers of time, distance, and provider scarcity. There are a few success measures that one can use to really consider how technology is impacting the timing and quality of care. 1, time to consult fulfillment, benchmarking the time duration between the consult request from the patient or from one of your home health visiting nurses or clinicians and the provider response versus less dynamic, non-video-based platforms such as in-person or telephone consults. As Laura pointed out, there were many times that her drive time was saved and better utilized to really talk and interact with the patients and their family caregivers as soon as possible versus being behind the wheel, especially in the Sacramento and Bay Area traffic, where it could be 90 minutes just to go what would be in other areas of the country just a couple miles. Another success measure to consider is the diagnostic accuracy. Measuring the diagnostic accuracy to ensure that your platform helps providers recognize and resolve presenting conditions. A third success measure is tracking patients' adherence to treatment and demonstrating how your home health agency's communication programs are impacting health behavior, positioning your organization for downstream profitability and cost savings. And of course, that leads to measuring readmissions rates. So what your agency is doing by using virtual care to prevent penalties for a broader healthcare ecosystem by keeping patients at home, identifying when interventions are needed, avoiding care escalation, and essentially freeing up bed space in the nearby community health facilities. Measuring the redistribution of staff, the load balance resources across entire systems is very important. So as Laura pointed out, there's tips to obviously increasing adoption and utilization of the platform. At Cincy, we pride ourselves with a very intuitive user experience for all involved so that training is very minimal and it's something that people can immediately pick up, download on their smart devices, and begin to use it as soon as possible with their colleagues and their patients. Tracking revenue from downstream treatment of appropriately transferred patients and or subsequent use of other in-network of services is important to a lot of facilities and a lot of physicians, but also looking at the referrals that home health agencies are receiving from community and institutional sources is very important. And of course, that's how patient satisfaction, loyalty really can positively impact the brand equity and the reputation that your agency has within the area and the community that you serve. Cincy has developed a state-of-the-art integrated communications platform which goes beyond traditional telehealth applications. Our configurable framework enables home health providers to effectively address specific patient needs easily and seamlessly. With our award-winning virtual care communication platform, we strive to help enable better performance for post-acute care organizations and champions, better access for patients, and better outcomes for all. We are dedicated to providing better ways for you to manage and engage patients simply and efficiently, and we look forward to the opportunity to demo our platform, share additional customer use cases with you, and discuss how it can help your organization provide innovative and differentiated patient-centric care. We'll pause now. If there are any questions, we will review them quickly in the window. For some of these, we'll respond individually to those at hand. Well, thank you, everyone. We do appreciate your time and interest in today's presentation. I thank Laura especially for sharing her experiences and insights regarding current and future use cases for virtual care with home health, palliative care, and hospice organizations. As Laura mentioned today, it will be crucial for home health organizations to use virtual care communication platforms to help deliver compassionate, critical care in a more timely manner. This concludes today's presentation. A link to the recorded webinar will be sent to all attendees and registrants in the near future and also posted on our website, cincy.com. Thank you again, for your time and interest.